The COVID-19 lockdown in the country has not been good for blood donations and storage. Nigeria's blood donation level, which was already low before the pandemic, was further strained by the outbreak. As correspondent Kelechi Emekalam reports, a non-governmental organization has come up with a plan to draw attention to the problem and change the narrative for those in dire need of the life-giving substance.
35-year-old Nigerian Lydia Ghana suffers from sickle cell anemia. The life-threatening disorder means there's a shortage of healthy red blood cells to carry oxygen in her body. Lydia knows what it's like to depend on blood transfusion to survive. Since her first sickle cell crisis at age 3, the constant trips to hospital have been traumatizing. But what frightens Lydia most is the long wait for costly blood donations.
Usually, for me, the person who donates blood for me used to be my mom, but she's of age now, so she can't really donate blood for me. You know, it's hard. It's hard when you walk into a hospital and then you need blood immediately. You have to buy blood. The whole process is messy, and this is I don't think it's right. Blood isn't something that you should trade with.
According to the World Health Organization, Nigeria has one of the lowest blood donation rates in the world. Its 200 million strong population has an annual blood demand of 2 million units, but it barely meets 25% of that demand. WHO says that only 10% of donors do it for free, 60% do it for money or other gains, while 30% only donate to family members. But Haima Health Initiative, a non-profit blood bank organization, is seeking to change this narrative. The initiative uses digital technology to save lives like Lydia's by connecting hospitals and patients with donors. The network already has more than 1,000 donor subscribers who have given 300 pints of blood.
I'm actually a sickle cell patient, so this initiative is kind of personal to me because I understand how it is getting blood. Whenever we fall sick, we help get donors through our database. We have a database where people sign up to be voluntarily the blood donor, and whenever there's a blood request, we go to our database and check for the matching blood group and the blood donor. Then we call the blood donors and give them the address of the hospital, and they go donate blood. We've been using social media lately, social media and then phone calls.
One of the major things the organization seeks to do is overcoming the myths many Nigerians believe about blood and blood donations, and their campaigns are inspiring more to donate.
I realize each time I donate blood, I feel good. So that's what actually inspires me, because I feel I'm saving life. As a first aider,
if you're donating blood, you are saving lives. Number 2, you give your body an opportunity to form new cells. A voluntary blood donor will have a lower incidence of having cancers, of having cardiac problems too.
A WHO study in 2019 shows Nigeria's blood collection capacity is at an average 600,000 units per annum, grossly insufficient for its population of 200 million. Without a cultural shift to voluntary donations, the country may struggle to meet its demand for life-saving blood transfusions.